Now onto osteoporosis or brittle bone disease. And osteoporosis is a condition of excess bone resorption. So when they have too much bone resorption, they're going to wind up with these porous, fragile bones like you see here. And as those bones degenerate, we're going to see height loss or kyphosis. That's where they get this stooped posture and they look shorter, and they're going to be at risk for pathologic fractures. So all it might take is a fall on an outstretched arm and they'll fracture their wrist. So who gets osteoporosis? Well, the risk factors for osteoporosis are going to be anything that decreases bone density. So obviously things like aging. This also happens more commonly in individuals of white or Asian ethnicity, but the two big ones to know are going to be having low estrogen, like postmenopausal females, or someone who's used corticosteroids for a long time, because you know corticosteroids increase your bone resorption, as does hyperparathyroidism or decreased bone density with inadequate calcium vitamin D or too much smoking and alcohol. So in order to slow that bone resorption, we need to teach these clients ways to promote their bone health. And the big one is going to be with weight-bearing exercise. So I know we said that swimming was a great idea for someone with arthritis who needed to lose weight, but it's specifically that weight-bearing form of exercise like walking or weightlifting that's going to tell the bones that they need to grow denser. So that's what we want to do for someone with osteoporosis. And because they are at risk for fractures, they need to avoid any high impact activities like horseback riding or skateboarding. So walking, great for these guys. Swimming, horseback riding, not so much. We also want to promote their bone density by making sure they're getting enough calcium and vitamin D, calcium being in things like dairy and green leafy vegetables, and vitamin D in salmon, eggs, and in a safe amount of sun exposure. We also need them to stop smoking and limit their caffeine and alcohol, and they should get regular DEXA scans to monitor their bone density over time. We can also give medications called bisphosphonates that help increase bone density. These are going to be medications that end in dronate, like alendronate, ibandronate, and these work by slowing bone resorption. But an important tip to remember for these is that they can cause esophagitis. So we can teach our patients how to prevent that by taking these with a full glass of water and to remain upright for a full 30 minutes after taking the drug.